Hi, my name's Izzy. I'm going to be your student nurse today. Can you tell me your name and date of birth?
Tina Jones, March 14th, 1996.
Awesome. Patient is the correct patient and she is alert and oriented. So I'm going to be performing a neuro assessment on you, so I'm just going to start by asking you some questions. Tell me why you're here today.
For a little checkup.
Awesome. And then can you tell me where you're at?
Villa Playhouse.
And can you tell me what day it is?
December 25th.
Awesome. So patient is oriented to person, place, situation, and time. So like I said, I'm going to be performing a neuro assessment. If you could just put this on with the ties in the back and empty your bladder before I come back. But just let me know if you feel uncomfortable at any time or if you have any questions. So I'm just going to give you some privacy here. Awesome. Patient's speech is clear, free of stuttering, the appropriate volume, and she responds to all my questions appropriately. So I'm going to start by just having you put this over your eye.
Okay.
And just let me know when you see my finger.
Now.
Awesome. And you could do the other one.
Now.
Perfect. So I'll just take that. Next, I'm going to be just asking you a few questions. So I'm going to start, do you experience frequent headaches? No. Do you experience any numbness or tingling?
No.
Do you have any problem moving about? And have you experienced any loss of consciousness, fainting, or felt like you're going to? No? Okay, so patient does not experience any neuromuscular dysfunctions, but if she did, I would follow with Goldcart's ice and further assessment that are age appropriate. Okay, so now I'm just going to ask you to walk to the TV and back. Perfect, you can sit down. So patient is able to, her gait is steady, balanced, and she shows no signs of unbalancedness, and she does not swing her arms unbalanced. Okay, so sorry to make you do this again. I'm just going to have you cover your right eye, and now tell me when you see my finger.
And now.
And again.
Now.
Perfect. Patient is able to match the examiner's eye. Okay, so now I'm just going to shine this light into your eye. Perfect. The corneal light is appropriate and reactive, and also equal bilaterally. Okay, so now I'm just going to perform a quick eye exam. So I'm going to do this one more time. Perfect. Now follow my pen. Perfect. Pupils are equal, round, reactive to light, and accommodating. So now if you could just open your mouth and say ah.
Ah.
Perfect. Sorry, let me look at there.
Ah.
Patient's palate and uvula are symmetrical. Okay, so now if you could just clench your mouth and grit your teeth. Perfect. Now raise your eyebrows and close your eyes tightly. And purse your lips and puff your cheeks. And then show me your teeth and smile. Awesome. Patient is able to perform all requested things appropriately and with no problem. Now can you push against my hands? Perfect. Patient's upper body strength is equal and bilateral, 5 out of 5 strength. Now can you stick out your tongue and move it up and down and then side to side? Patient is able to move her tongue symmetrically and equal bilaterally without any problems. Okay, so now could you walk to the TV and back? But before you do that, you're going to go heel to toe all the way there and back.
Okay. And back.
Yes. Okay, and then, actually, sorry, you're going to have to stand up
That's
still.
okay.
Now, if you could close your eyes and put your arms by your side. I'll be here just in case you fall. Awesome. Awesome. So patient is able to perform both instructed things without any problem. Her gait is unsteady or is steady and balanced with no swaying, and then she is also able to stand with her eyes closed without swaying, and she is balanced. Okay, so now you're gonna take your 2 index fingers out like this and touch your nose with your index fingers with your eyes closed, and I'm also here if you fall. Perfect. That's good. Now you can sit down. Patient is able to perform the instructed things to do. Okay, so now I'm going to, you can lay down, sorry.
Okay.
Now I'm going to be testing a couple of your reflexes and just seeing if you're able to feel the touch. First, if you could take your heel and put it on your knee and glide it down your shin. Awesome, and then the same with your other leg. Perfect. Patient is able to perform the instructed activities. Okay, so now I'm going to be touching this soft Q-tip on your face, arms, and legs, and I just want you to point to wherever I touch. It's just going to feel like a light touch like that.
Mm-hmm.
Okay?
My cheek.
Just point. You don't have to say it.
Oh.
Awesome. Patient is able to perform or is able to identify the location of the soft touch. Okay, you can open your eyes. So now I'm going to break this Q-tip and I'm going to touch your arms, legs, and face again, but sometimes it's going to be a soft touch like that, then other times it's going to be a sharp touch like that. Just let me know if you feel sharp or soft or dull, either way, however you want to describe it. You can close your eyes again.
Soft. Dull. Or sharp. Sharp again. Soft. Sharp.
Awesome, you can open your eyes. Patient is able to identify the sense of touch, either sharp or dull. So now you can sit up with your legs down here. Awesome, so I'm just going to be checking your reflexes. So just dangle your legs and stay relaxed. Perfect. Her patellar reflex is equal and bilateral and 2+. So now if you could just, actually you could stay seated.
Okay.
So I'm just going to do the same thing. Stay relaxed. Perfect. Perfect. Okay, now relax your arm like that. Awesome. Awesome. So patient's brachioradialis reflex is equal bilateral and 2+, as well as her brachioradialis and can't think of the other name, but I will figure it out. So if you could just lay down here one more time, sorry. I'm just going to be doing the quick test on your reflexes again. Awesome. Patient fails to show signs of Babinski, or failed the Babinski test, which is a good thing. Okay, we're all done.
Biceps reflex.
Biceps!